So this is a question on hypoglycemia. Let's see how best we can solve this. We have a 30-year-old nursing student. That's key. Presents with confusion, sweating, hunger, and fatigue. Her blood, so it presents with some symptoms. The blood glucose level is noted to be 40 milligram per dl. That's like far less than 3. That's less than 3. She has no history. That's less than 3 millimole per liter. She has no history of diabetes, so this is kind of a spontaneous hypoglycemia. Although his sister has an insulin dependent diabetic, so the sister has diabetes, type 1 diabetes, so maybe on insulin as a result of that. It's a nursing student, like a health worker. So putting everything together, probably this patient has gone to take the sister's insulin and has injected herself. The patient reports several similar episodes over the past year, all occurring just before starting her early morning shifts. Okay. On this evaluation, she is found to have high insulin levels. So we are trying to find the cause. Patient has hypoglycemia, has been having recurrent hypoglycemia, is a sister to a known type 1 diabetic who is taking insulin for blood sugar control. Okay, and she's a health related person, nursing student. So the patient has high insulin levels and low C-peptide. That means it's like exogenous, something coming from outside. Because if we were from inside, then you have high C-peptide levels as well. So the patient has been taking the insulin from outside. And what is the most likely diagnosis? Now let's look at reactive hypoglycemia. This definitely does not make any sense. Early diabetes, we have a high blood sugar levels. Factitious hypoglycemia makes sense because the patient is a health related person. Nursing students comes in with recurrent episodes of hypoglycemia. Then you have having exogenous insulin intake, which may be from the sister. Okay. So most likely we have factitious hypoglycemia. Insulinoma. For insulinoma, it's endogenous. So you have insulin going up and also C-peptide going up. But this is the case that we have insulin going up and C-peptide going down. So it's most likely from outside. So factitious hypoglycemia is the most correct or suitable answer. So our answer is factitious hypoglycemia. Thanks so much for joining us for this video. I hope you learned a lot from this.